Fit, active, healthy, happy, enjoying the prime of your life. Looking out for your health and wellness, this is Health Talk with Fred Lowry from Lowry Drug in Statesville. Visit Fred at his store, conveniently located on Hartness Road in Statesville.
Good afternoon. This is Fred Lowry, pharmacist and doctor of natural medicine, and this is Health Talk. This episode was pre-recorded for July the 3rd, 2026, coming up on the 4th. Welcome to the program. This program is based on my knowledge and experience. It's not intended to be medical advice, so you should seek out individual advice from a qualified healthcare provider. Welcome to the program again. We've got I think an interesting program. We were talking about immune health related to many things, and 2 weeks ago we touched on hormones being relative to that. And so we're going to talk about men and women's health and hormone health, primarily for women. And part of this is related to bioidentical hormone replacement, particularly focusing around vaginal health. There's a lot more focus on that from the physician area and pelvic floor health, which includes, the uterus, vagina, bladder, all the vascular tissue there. And so that becomes a big issue as women age, and we're going to talk about that in some really great ways to help maintain your overall health and well-being. And a lot of that is related to bioidentical hormone replacement. I've been involved in this particular area of drug therapy for over 45 years as a compounder and a student of this particular area, so it does have great interest to me. But one of the things that brought this back to my attention, there was a study about immune health related to aging. So as we age, our everything maybe gets a little worse gradually, and our immune health is part of that, and particularly with women. So, of course, we all know women live longer than men. It's been said about 5.6 years, and yet they account for as much as 80% of the autoimmune disease. So we think about aging as something that happens on the surface, wrinkling skin, graying hair, etc. But it's really something that happens inside. And so you do have aging of the cells, aging of your immune system, your ability to fight infections. Your immune system ages in different ways. The study, it was a Nature aging study. It was tracking the activity of 20,000 genes inside of immune cells and your immune system. And it showed that men and women showed distinctly different aging patterns. Women's immune system becomes more reactive, more inflammation, as they age, and this can translate into autoimmune diseases. Men don't have that as often, but they have apparently more cancers. So there are definitely differences. Lifestyle. That might be a good term. Age style, the style of your life, perhaps, and as you age. But it does. Your lifestyle does determine the trajectory of these things and how you age, and so your aging, your health is based on what is called your lifelong exposure is immunobiography, if you will. So it's all cumulative based on when you were conceived, the health of your mom, the lifestyle of your mom, the events that she experienced while carrying you, and then of course, your environment, your diet as a human being on the planet, and all the things that you've been exposed to. So, including life events. So, all of this leaves an imprint on your immune system, and we could include, even things like grief. We've certainly seen how emotions impact immune system. Someone has a loss, and then they get some type of infection. Very common to see older adults that may lose a spouse, and then they contract shingles sometime after that. So all of this does impact your immune system, and we think about DNA as being part of that. The epigenetics, which are the factors that turn on or turn off genes, that's certainly part of the picture. But basically, your longevity, your immune health, they are intertwined. So your immune system's aging path determines how those years, those adult years, aging years, actually feel and how you function. So obviously, energy plays a role in that. What we always talked about seed oils and sunlight and all the things that play a role in that. But certainly, immune function or hormone production impacts immune function, and the decline as you age has a pretty big impact. The decline in hormones, especially estrogen with women, is directly connected to both immune system changes and a higher rate of autoimmune disease. So declining estrogen is more pro-inflammatory. It decreases immune regulation effectiveness, and overall hormone decline also compromises your immune system. It's been said that 80% of autoimmune patients are female. Menopause accelerates immune system instability, regarding the protective aspects of estrogen. As estrogen levels drop, there's an increase in autoimmune conditions. So we have major hormone transitions, puberty, pregnancy, menopause. All of these can impact our autoimmune disease. So why do women have more autoimmune issues? This actually can be bidirectional, which means hormone imbalances can contribute to autoimmune onset, but also autoimmune diseases can contribute to autoimmune issues as well. Everything seems to be somewhat bidirectional, So the takeaways is declining estrogen has a big impact on your health. Stay tuned for more health talk. Welcome back to Health Talk. This is Fred Lowry, Lowry Drug in Statesville. We're talking about aging related to hormone decline. It certainly happens to men. It's called andropause. Decreased testosterone in men certainly impacts immune health. It's a complex relationship. So both testosterone that's too low causes problems, and too high can be problematic as well. You can imagine what that looks like. But low testosterone is really more what we're interested in. So if your testosterone is low, you have more inflammation, more chronic inflammation, overproduction of white blood cells, which can lead to autoimmune disease. Low testosterone, interestingly enough, and related to COVID and viral disease, yielded a higher probability of ICU admissions. So if you had low testosterone, you were more likely to be sicker. And ICU patients who died apparently had significantly lower testosterone levels. Now, don't know if those levels dropped because they were sick, because there's certainly compensatory mechanisms that the body has when you're under stress to make more steroids. More steroid hormones like cortisol. So, which is an example of when you're under stress, your body makes more cortisol and other hormones. It's kind of like the scenario: if the tiger's out to get you, you're not really interested in reproducing. So other sex hormones do drop, and so there is a little bit of a seesaw effect here. Research shows that testosterone has really kind of a nonlinear relationship with the immune system. Low testosterone, you have white blood cell production leading to inflammation and autoimmune, but high testosterone also reduces immune response efficiency. So, of course, we're looking for that healthy balance. Now, I want to explain what bioidentical means. So we have hormone replacement that involves commercial pharmaceutically produced products. Some of those are bioidentical. And then we have what some people call synthetic, but I would rather call them just non-bioidentical. They're hormone therapies that are commercially available that are manufactured, but they're not the same chemical structure that your body makes. So bioidentical means the hormones are chemically identical to the ones that you make, most commonly estradiol, progesterone, testosterone, those hormones. And not to bore you with the chemistry of it, but if you were just to look up does testosterone look like as a chemical structure versus what does estrogen look like, they're so similar. They have just minor changes in the structure, and yet they have such different messages that they transmit to the body. And so what happens is, if you get a particular estrogen or testosterone that's not bioidentical, you're basically talking a different language. They have different impacts. A great example of that is progesterone. Progesterone is like progestation. It's the hormone that stays elevated when a woman's pregnant. And so the commercial product of that is medroxyprogesterone. That's the different language. You can't use these interchangeably because progesterone helps maintain the pregnancy. If a woman takes medroxyprogesterone, she will abort that baby. So, when we look at drugs or hormones that are in the same class, just because they're in the same class, does not mean they do the same thing. So keep that in mind. So the benefits in general of using hormone replacement for women is basically the symptom thing: hot flashes, night sweats, vaginal dryness, pain related to intercourse, mood changes. So all of these are classified in terms of vasomotor symptoms, but they're also genital urinary symptoms related to menopause, all the urinary incontinence and urinary tract infections and all that. One clear benefit of hormone replacement is bone health. And so estrogen, progesterone, and testosterone are all needed for healthy bones. And so hormone replacement can prevent bone loss and fractures, which obviously is a big deal for aging adults, but you can also think about that as a symptom of aging. Why would the bones get more brittle? Other areas could be related to energy, libido, mood, cognitive clarity is a big deal, and testosterone is really important for that, as well as estrogen. So there are other disease states that some people may talk about: diabetes, dementia, heart disease, all these things. Not quite as much support for that, but there is information about that. So the advantages basically is that bioidentical hormones mimic the body's own hormones. They're speaking the same language. So if you're taking any kind of hormone replacement, I always recommend using bioidentical hormone replacement. So there was an article related to what was termed the universal use of vaginal estrogen after menopause. This was a Substack article from Dr. Robert Yoho, and it's a pretty good article. The new terminology is GSM, genitourinary symptoms of menopause. That's a big catchphrase, basically, but the concept is that after menopause, after the reproductive years, the ovaries make estrogen, estradiol, and other hormones, but after the woman is no longer producing eggs, that's when menopause takes place. Hormones diminish: estrogen, progesterone, testosterone could be part of that. And so when estrogen diminishes, then you end up with vaginal and urinary tract issues. This can be almost debilitating for many women, and that's why this becomes really important. So the hormone replacement goes far beyond hot flashes and mood changes. And I think this is routinely undertreated, but basically the estrogen loss causes the vaginal walls to lose their natural folds. It changes the microbiome of that environment as in mood changes. And I think this is routinely undertreated, but basically the estrogen loss of that environment is generally should be acidic. The Bacterius lactobacillus, the pH rises and creates an environment for bacterial overgrowth or yeast proliferation, atrophy. And but this damage extends way beyond external genitalia. All of these have estrogen receptors. Level of problems associated with this. There are symptoms out there: dryness, burning. Those get attention. Pardon me. But the ones that are more debilitating are urinary tract infections, thinning urethral tissue that excludes maybe bacteria, altering the bacterial flora, all of these things. And these urinary tract infections, particularly in senior adults and women, can cause major psychological episodes. And so that's a very common thing, very odd. but urinary tract infections can almost yield an individual to be psychotic. So this, as you can see, the importance of this and the replacement using estrogen, estradiol, very safe and extremely effective in dealing with some of these issues. Stay tuned for more health talk. This is Fred Lowry of Lowry Drug in Statesville.
Doctor, my eyes have seen the years.
Welcome back to Health Talk. This is Fred Lowry, pharmacist and doctor of natural medicine, Lowry Drug in Statesville on Hartness Road. We are a family pharmacy established in 1959. A very unusual pharmacy, if you will, a traditional pharmacy, but also have a very extensive compounding lab. And we also have been involved in medical equipment for many years, but we have a great line of different supplements, probably one of the best selection of homeopathics around. So come see us, check us out on Hartness Road. We're talking about hormone replacement, particularly right now, the area of women's health and estrogen replacement, estradiol for vaginal related symptoms as we age. And we were talking off air about the issue with hormone replacement, and there was a Dr. Ronald Brown in Charlotte that wrote a book called The Youth Effect, and basically he was just saying that the hormone replacement helps maintain the way you feel, maybe not as a youth, but in terms of the aging, it does help with healthy aging. We have ladies in their 80s that are still using these products, and they're doing quite well, and they're very active. Of course, everyone's an individual, so you have to take that into effect. So, when you're looking at thinking about the use of estrogen replacement, estradiol in particular, that is commercially available and also available as a compound for more specific or individual products as well. But this situation as women age, as men age, hormone decline in women certainly has an effect on the quality of life and intimacy related to relationships. Of course, the issue of potential vaginal infections can compound that issue in terms of either bacterial or yeast. And we'll say that oral hormone estrogen replacement not really recommended. Even if you did take an oral product, it gets into the bloodstream, but it really doesn't get into the tissue levels in the pelvic floor. So it's just not enough to be on any kind of oral product. The vaginal estradiol binds to those receptors in that area, and a lot of people don't realize there's also testosterone receptors there that play a different role. So this estrogen causes the epithelium to thicker, the lining to thicken. Glycogen returns to the cells. The bacterial environment improves local immunity. So studies consistently show a 50 to 75% reduction in recurrent urinary tract infections with vaginal estrogen use. So much better choice than thinking about antibiotics as prophylaxis. There's availability in a cream, vaginal suppositories, vaginal tablets, So there's a lot of delivery systems. The cream is more flexible, but some individuals don't necessarily want that. But it is commercially available. The compounded versions, the potency is a lot easier to vary. And we can also do some combinations that I'll talk about later. The compounding sometimes actually is less expensive than the commercial products. I think that's kind of moved along. The safety, particularly of vaginal creams, very safe. Some people are concerned about that and the cancer risk, but there are other options, and the cancer risk is not really that great. And even women that have had cancer in the past have been prescribed estradiol vaginal cream for symptoms. So that's obviously something to discuss with your physician, but apparently the North American Menopause Society, the British Menopause Society, and the International Menopause Society all states that low-dose vaginal estrogen is acceptable even in breast cancer survivors, though, as they say, an oncology consultation for that is appropriate. So those are things to consider. In the International Menopause Society all states that low-dose vaginal estrogen is appropriate. So those are things to consider. Now, there is the use of DHEA, which we're going to talk about. And this is the advantage of the compounding. Of course, the testosterone precursor to estradiol and testosterone. So locally, it's a good choice for people that, and the DHEA will actually convert to either testosterone or estradiol, where it can be used in the tissue there. Hyaluronic acid is a non-hormonal product that is used for vaginal dryness, and that's something that we have actually combined in the compounding laboratory with the estradiol, so that's an option. Interestingly enough, another hormone has come online recently, and that's oxytocin. Oxytocin is the hormone that people experience with closeness, feeling in love, that type of thing. But it has an impact on improving the lining of the uterine wall. So that's another product that we have made, in the compounding lab. I want to go back to the DHEA. The DHEA is a steroid hormone. It's made in the adrenal glands, so it has a balance for adrenal stress. So it's another use for that. Interestingly enough, you can buy that over the counter. In some cases, we have it. We've also made it in the lab as a sustained release product. But it's basically a building block that can convert to testosterone or estrogen, depending on the enzymes that are present. So it's like a parent hormone, and it seems to balance out the stress hormone cortisol. But it's basically a building block that can convert to a parent hormone. And it seems to balance out the stress hormone cortisol, testosterone, and so that certainly plays a role in libido, and can also be associated with immune support. Here we also have another hormone looking for that balance. So when DHEA levels are that adrenal thing, your stress hormone system. So DHEA can be like a buffer for that stress. Stay tuned for more health talk.
To leave them open for so long.
Welcome back to Health Talk. This is Fred Lowry. We're talking about hormone replacement, primarily related to women. So, going to the value of testosterone for women, we think of that more as a male hormone. There are commercial products for men. There are not really any products for women, but it is a very popular thing, and a lot of times it's not necessarily related to libido as much as it is cognitive function and a sense of well-being, which is also really important for men, obviously. But you can use DHEA vaginally, but testosterone it can be used as well. So there are actually testosterone receptors vaginally. It's considered an off-label use. So FDA has actually approved vaginal DHEA, but not testosterone. And so it does become an option. The DHEA is certainly a good choice, along with either estrogen or testosterone, having all the benefits that we talked about. But when you use the testosterone, you're delivering that androgen directly to that tissue. So it really it is probably a better choice. Estradiol is, of course, the driver of the classic rejuvenation response of vaginal tissue with all the symptoms, but the testosterone acts differently. It doesn't necessarily thicken the epithelial tissue, but it does influence the tissue, and this is interesting to me, as it influences the nerve biology. It actually changes adrenergic nerve fibers and possibly sexual function related sensitivity. A study found that estradiol and testosterone had different effects on vaginal tissue. The testosterone seemed to alter nerve fibers, which is, I think, something I had actually never run across before. But what does it mean when it talks about altering these fibers? It actually helps regulate the blood vessel tone, which is important to the tissue and signaling there. So it actually increases the number and density of these small nerve fibers, suggesting how it may change the sense of stimulation. So the nerve fibers, is part of the local wiring system, is part of the blood flow, the sensitivity, the communication. It also can alter pain perception, and so it really has quite a different effect related to that. So, if we talk about hormone replacement, we must talk about progesterone related to all of this. So, progesterone is one of the steroid hormones, and keep in mind that all of these hormones are made from the LDL cholesterol that is characterized as being bad. But progesterone is also a counterbalance to estradiol. So estradiol has to do with the thickening and the maturing of the lining, and progesterone is more about moderating that the effects of the estrogen. So if we go back to a normal cycle, you think about it, it's 28 days, and then 2 weeks in the first part and 2 weeks in the last part. the first phase is more estrogen dominant. Day 0, which is when the period starts, to day 14, which ovulation occurs around that time. And then the 2 weeks after, which is more progesterone dominant. So the estrogen causes the cell growth. The progesterone comes on to help maintain that briefly in case a woman conceives, and the progesterone, progestation, stays high to maintain the pregnancy. If conception doesn't happen, then that triggers a drop in the progesterone, which then the cells come off and triggers the woman's period. So progesterone is a counterbalance to estradiol, and that's just not in one area of the body. It's not a compartment. Hormones become a total body experience. Pardon me. So this becomes important because unfortunately medical schools are still teaching that once a woman has a hysterectomy, she no longer needs progesterone. That was only done because if a woman takes estrogen only, it created endometrial cancer, and that was the Premarin product, where you didn't balance out. This was an oral product. Pardon me. Completely different than topical creams. Okay, so it's not that estradiol causes cancer. It was the imbalance of the Premarin, which is pregnant horse urine estrogens that women were taking. They got endometrial cancer. The way they prevented that was to give them medroxyprogesterone product. So the concept is we were giving the progesterone to offset the issues of the previous drug. And so since we don't have a uterus anymore, we don't need to worry about that. That's wrong. Progesterone, there are progesterone receptors all through the body. So it's wrong from the total body approach. It may not be wrong from the symptom approach, but that concept was taught when I was in pharmacy school. That was back in the late 70s. So progesterone is really important. It's not necessarily as important if you're just using vaginal estrogen, but if you're using estrogen creams or other more total body estrogen replacement products, absolutely progesterone is important related to that. This also, I might mention, is related to a young woman's cycle if she's having issues related to that. That's usually caused by not enough progesterone. They're estrogen dominant. And this is the issue with any kind of endometrial overgrowth of the tissue. It certainly can be also related to issues around pregnancy as well. So we do have estrogen receptors all over the body. There's progesterone receptors all over the body. Women can testify to that related to breast tissue and other areas. So it's a continual changing process, and stress relates to this. Either more stress or the lack thereof can alter hormone balance. Certainly there are other things that play a role in that, life stressors, etc. But there are progesterone receptors in the brain and breast tissues. There are progesterone receptors for men. Like all of these hormones are part of a male makeup and a female makeup, just only in different areas. So it is really important related to your overall health. Progesterone has effects on your immune system as well. It's especially important for pregnancy. It allows the woman's body to tolerate the embryo to maintain the pregnancy. It can help with autoimmune flares, so progesterone can have an impact for women that have autoimmune disease. It improves resilience. It has a calming effect. It's used for improving sleep, blood flow. There's also been usage of it related to strokes and blood flow, brain function. All of these things play a role. And a topic for another episode would be how all the chemicals have impacted everyone, including immune health. I mean, there are pesticides, herbicides like atrazine that actually change the sexual orientation or genitalia of amphibians. It's really crazy how these hormone mimickers, chemicals, plasticizers, has impacted everyone's health. And, it's kind of hard sometimes to override that, but all of these things, obviously your health is it's not just one thing. It's just not one vitamin, one drug, one hormone to help maintain your health. It's a total program. It's basically the style of your life. So I hope you have a great holiday coming up. Be safe. Come see us at Lowry Drug. This is Fred Lowry of Lowry Drug in Statesville.